Morning. So here we are again, another appointment. Today is a lot of appointments. Today is my pre-op meetings. So I have one right first thing in the morning. I think this is just a weigh-in. So I'm going to try and sneak you in today, but we'll see what happens. See you soon. I won't record the nurse. Okay. Okay guys, you get to see my... I don't want to see it, so I'll just do this so you look at it. Okay, so can you see 296.9? And I lied to you in my last vlog, so I'm not 278, whatever. Hi, so back again. So the first appointment wasn't that exciting. It was mostly the weigh-in. They did give me some information though. So the last minute what to know. So it's between my new phone and my new truck, I don't have anywhere to sit my camera like I used to. So basically they talk about, you know, what sort of medications to take the day or night before. I'm not on any kind of medication, so that doesn't apply. Time to be at the hospital, well, they don't know because my appointment date, they're calling me the day before my hospital stay. So they're going to call me like Sunday night. Which is odd. I thought that was strange they'd call on a Sunday, but so be it. Items to take to the hospital. CPAP machine, nutrition handouts. I don't have a CPAP or anything, so I don't need that. Then they ask, hospital pickup arranged. Yes, my husband's going to come get me. House stocked with fluid and diet items. Well, not yet, but it will be, because now I have my fluid list, which I'll go over. Forms for work and insurance, that I gotta take to the hospital, so for my time off work, that kind of thing. Follow-up appointments to clinics made. I've made all my appointments as far as I know. Family doctor aware of surgery, yes, he's the one that referred me. Follow-up appointment made with family doctor, I still have to do that, and that appointment, I have to make a follow-up 7 days after my surgery, approximately, for him to check my sutures and to remove the staples, because they're going to staple my incisions closed. Medication review of pharmacist, ensure you're aware of what medication cannot abruptly be stopped. I'm not on any, so it's not applicable. Post-operatively, so after surgery, before you're discharged from the hospital, find out. Ensure you are seen by your program dietitian for protein and fluid targets, and ask for any questions before you're discharged. So while I'm in the hospital, my nutritionalist, Lee, will come and see me and give me my protein and fluid goal per day. Wound care instructions, so the nurses at the hospital will tell me how to take care of my incisions. Medications, again, that's mostly going to be pain management. It's usually Tylenol, some codeine, something like that. Make sure you're aware of how to take your regular medications and any prescriptions that you are given for pain or nausea. So, like I said, they're going to give me Tylenol with codeine, more than likely something like T3s. Nausea, you know what, I'm fairly sure I'll have nausea. I get car sick. I get standing still sick. I have, and it's funny because I don't have a weak stomach for gross stuff. Like, I can watch slasher flicks. I can, you know, clean babies and all that, and nothing affects me, but surgeries and that kind of thing, I tend to get fairly nauseous. So activity, begin walking around as soon as the nurse caring for you on patient care unit determines you are steady enough for after surgery. So they like you to get up. It helps with blood flow. It helps a lot of times after surgeries, because they're messing with your bowels and your intestines and everything like that. You can end up with constipation and really horrible gas. So the best way to get that worked out is walking around, like get the gas pain out. So that'll make you feel better. Call 911 or go to the nurse emergency department with sudden shortness of breath, lightheadedness, or chest pain. Pretty. Then there's the phone numbers to call, and the case manager's name and phone number for me. So that's, I gotta take this to the hospital. And then the other thing I was given is my bariatric full fluids sheet. So after the surgery, I'm only going to be able to have so much stuff. I'm not going to be able to have really solid food, no chunkies kind of thing. So what is a full fluid? It's a full fluid is any food or drink that is liquid and melts at room temperature, melts in your mouth like jello, can be poured like water or milk, is pureed or baby food texture like applesauce, does not have solid pieces of food in it. And so, what should I choose? Below are the full fluids you should choose. This is boring. I don't know if you really want to hear this or not, but hot cereals, so oatmeal, oat bran, cream of wheat, that kind of thing. 100% pure fruit juice, limited to 125 ml, half a cup per day. Applesauce or other pureed fruit that's unsweetened. Vegetable juice that's low sodium. Skim 1% milk fat, lactate milk, or a low-fat soy fortified beverage. Smooth yogurt or yogurt drink, no fruit pieces. Jello, pudding, custard, soup, strained, blended, or broth. Tofu, soy, that's the soft or silky kind. Popsicles made with artificial sweetener. Decaffeinated coffee or tea or herbal tea. Water or low-calorie beverages like Crystal Light, fruit-flavored waters, diet iced tea, diet lemonade. Protein supplements or meal replacements only as recommended by your doctor or dietitian. So I've been drinking, I mentioned to you guys I've been drinking the Boost and the Ensures because I was prepping for a liquid diet and I didn't need to do it. Kind of good, I guess, because I wasn't looking forward to 3 weeks of liquid diet. But yeah, I'm glad I prepped. So now I know what I like and what I don't like. What should I avoid? Basically, any solid or semi-solid foods, caffeine, alcohol, carbonated drinks. After surgery, no duh. So they talk about sipping your fluids. They talk about sipping fluids slowly from a cup or glass. Don't use a straw or sports type lid because you may drink too fast or swallow air. This can cause discomfort. So yeah, so that's my fluids, and my next appointment is in a little while here with the surgery clinic, the pre-op clinic. So I'm going to go and kill just a little bit of time, and hopefully I'll sneak you in there too. I wish there was more to see at this appointment. I asked the nurse, she's not my regular one, so I asked her if I could bring this in and show, and she was good with it, so maybe I can sneak you into this one too. Alright, I will see you soon. So exciting! Hi, so here I am again. I have been checked in, got my little bracelet and everything. This is the pre-op test, so they're going to check my heart rate and check my blood pressure and all that stuff, my lung capacity, that kind of stuff, and yeah. So I watched a video about what to expect for surgery, you know, the different anesthesiology stuff, and what you can eat and drink. So now I'm just in a very lovely gown. They're flattering, I know. I'm just waiting for them to come and do the other pre-op stuff. So we'll check in soon. Bye. So I just had a nurse come in a few minutes ago and did my ECG, checked my heart, and the electrodes coming off my heart or something to that effect. And that all looked good, so step 1 done. So now we're just waiting for the next one to come in. So another stage done. We had the nurse come in and she discussed with me the what happens the day of surgery, where to report, that kind of stuff, checked my history. Then at the same time I had the vampire come in. I have terrible veins. It's really hard to get blood out of me, so they had to poke me a few times to get the blood that they needed to make sure I'm okay. And now I'm waiting for the anesthesiologist to come in, and they're going to also take me for a chest x-ray. So 2 more done. Alright, so we have the anesthesiologist in, and everything looks great for me to go under sedation, so that's good. I just have the chest x-ray left to go, and yeah, it looks pretty good so far. They were talking about some of the parts of the surgery. Like I was telling you a minute ago, my veins are bad, so he looked at my veins and he said maybe they'd bring in one of their other guys to do it because my veins are so terrible. One of the other things is after your surgery, to make sure all the sutures are good, they fill up your stomach cavity with a blue dye. And occasionally, like it goes down here and through your nose to make sure there's no blockages, and there's a camera that goes down. And so they inject you with blue dye to make sure there's nothing there. And sometimes it sprays a little bit, or your lips and your teeth and might be blue, but nothing to worry about. And they said that you can have a sore throat afterwards because of it's a tube that they put down basically to empty your stomach contents, and the to and fro is what kind of hurts you. So, kind of gross, but informative. It's awesome. See you soon. Next step.